Hello guys, today I'll be talking about different liver obstructions in the vessels. So I would like to divide the obstruction in the liver into three different types. One is prehepatic, one is intrahepatic, and one is posthepatic. Prehepatic is when we have a hepatic arterial thrombosis. We have a hepatic arterial thrombosis, or vasculitis, for instance, atherosclerosis, preeclampsia as well. And the second prehepatic obstruction would be portal vein thrombosis, or anything that blocks the portal vein. I would like to divide portal vein thrombosis into two different types. We have acute and we have chronic. I will explain that later. Then intrahepatic is when we have the sinusoids that is dilated. We have an increase in intrasinusoidal pressure. We have the sinusoids here. This could be due to many reasons. One is sickle cell disease, which occludes the sinusoids, therefore increasing the pressure. One is cirrhosis, characterized by intrasinusoidal pressure increase. One is ileosis, which typically happens in Bartonella hensel, which is a bacteria that causes dilation of the sinusoids. And the second one is central lobular necrosis, which happens in any pathology that causes right heart failure, or any sort of right heart failure. Also, let's say constructive pericarditis. The last one would be posthepatic, which would be basically the hepatic vein. I would like to divide into two different types. One of them is Budd-Chiari syndrome and one is veno-occlusive disease. So let's say we have the inferior vena cava here, and then we have the hepatic vein draining into the inferior vena cava. So if we have obstruction of this vein, it is known as Budd-Chiari syndrome. There are numerous number of causes. One of them is increased coagulability. Second one is emboli, which is very rare because we generally can't have an embolus going through to the tiny hepatic vein. It's mostly to do with hypercoagulability, which happens in many conditions, such as in malignancy, typically anything that causes increased production of red blood cells, such as in polycythemia vera, and also in hepatocellular carcinoma. A dreaded complication is Budd-Chiari syndrome. Then let's go to prehepatic obstruction. Continue. So in this we have two different types. One is hepatic artery and one is portal vein. What do you think will be the symptoms in a prehepatic artery or portal vein obstruction? Will it be liver hepatomegaly, or will it be formation of ascites? What do you think it is? Obviously, it can't be hepatomegaly because the obstruction is before the liver, so it makes no sense of having hepatomegaly. So even any sort that increases portal vein hypertension does not have to really result in hepatomegaly, because there are numerous causes of portal vein hypertension, such as thrombus formation, pylophlebitis. You know what causes pylophlebitis in the liver? Oh yes, you know it, appendicitis. Quite a rare complication. Also, diverticulitis. Anything that drains the blood from the intestine and goes to the liver, or blood from the GI organ which carries bacteria, can cause inflammation of the portal vein, and this can cause occlusion, and therefore increase in portal hypertension, therefore formation of ascites due to increased hydrostatic pressure. The next one is hepatic artery. thrombosis. So in this one, I would like to divide hepatic artery thrombosis into different causes. One is obviously thrombus. The second one is vasculitis. The third one is transplant. The fourth one is preeclampsia. So basically, when we transplant any organ, okay, this is quite difficult to understand. So when we transplant any organ, for instance, the lungs, the heart, the kidney, the dreaded complication of each of these transplant organs is attack of the endothelium of every artery. In terms of, if I'm transplanting the liver, my hepatic artery will be attacked. If I'm transplanting the lung, my artery that supplies blood to the lung will be attacked. If I transplant the kidney, the renal artery will be attacked. So it will lead to something called endotheliitis, and therefore eventually reduce blood flow and increase risk of ischemia, therefore leading to obviously infarction. What sort of infarction we have in the liver? Pale or red? Obviously red. Dual blood supply, so can't be pale. What are the organs that cause pale infarction? Yes, you're right. It is kidney, heart, and kidney and the heart. Then coming back to intrahepatic obstruction, in which the causes are numerous. One is cirrhosis, central lobular necrosis, and the third one is obviously ileosis. Quite rare complication though, not necessary to know it. So cirrhosis is defined as hepatocellular regeneration with diffuse fibrosis. So how does the parenchyma look? So we have clusters of hepatocytes, clusters of hepatocytes, clusters of hepatocytes. Around these we have fibrosis. So what technically happens is we have a rise in sinusoidal pressure. What are sinusoids? Sinusoids are basically endothelial linings of the parenchyma of the liver. Okay, so we have increase in sinusoidal pressure, which causes increase in hydrostatic pressure, which therefore causes two things: hepatomegaly and definitely ascites. So when do we really have hepatomegaly? Simple. Anything that increases the sinusoidal pressure. Yeah. So we have hepatomegaly and ascites in cirrhosis due to this reason. Then central lobular necrosis, which happens due to heart failure, typically right heart failure or constrictive pericarditis. So when do we have? How to differentiate between cirrhosis and central lobular necrosis? It's quite simple. So both cirrhosis and central lobular necrosis will have a serum albumin gradient less than 1.5. But how do you differentiate between cirrhosis and central lobular necrosis? Central lobular necrosis in the ascitic fluid will have high acidic protein due to leaking of lymphatic and acidic proteins into lymph and acidic protein into the ascitic fluid. Second one is ileosis, which is basically quite simple. The Bartonella-Hensley causes hepatitis or mild hepatitis, which causes dilation of the sinusoids, which causes increase in sinusoidal pressure. Therefore, could present as hepatomegaly, a very rare complication though. Next one. The last one is posthepatic obstruction, in which we have the hepatic vein that is messed up, causing blockage, painful hepatomegaly. Why is it painful? Obviously stretching of the capsule of the liver. Or I would say fascia. Causes severe irritation to the peritoneum, and therefore you have pain. Then we have portal hypertension due to increased hydrostatic pressure. I would later divide Budd-Chiari syndrome into early and late. Okay. Coming back to blockage, after that, what is the cause of Budd-Chiari syndrome? Simple. Hypercoagulability, causes thrombus formation. Then we have embolization, rare. Then we have obviously malignancy, increases PC, increase in malignancy, which could be polycythemia vera, and it could also be hepatocellular carcinoma. It could also be renal cell carcinoma. Why? This increases EPO, causing hypercoagulability. Also, anything that produces mucus, any tumor that produces mucus, such as colorectal carcinoma or pancreatic carcinoma. However, the manifestations of each of these are most of the time very different. It's just to increase hypercoagulability, such as pancreatic carcinoma will lead to migratory superficial thrombophlebitis. However, this one will lead to non-bacterial thromboendocarditis. But yeah, don't get confused. I would just learn this rather than this. Yeah, that's it. The end of the video. Thank you.